what is pharmaceutical promotion? So, informational or persuasive activity undertaken by pharmaceutical companies and distributors, the effort of which is to induce prescription, sale, consumption of medicinal product. Now, most medicines are sold under prescription. Other articles, they can be purchased by consumer directly. Most medicines are sold under prescription. There are some exceptions like the over the counter drug, yes, like vitamins, calcium tablet, aspirin, paracetamol, low grade analgesic, some medicine of gastritis. Okay. So these are some of the products that are being sold over the counter. They don't require prescription. Otherwise, the rest of it are generated by, are sold under prescription. So prescription is written by, prescription is written by registered medical practitioner. Prescription is written by a registered medical practitioner. So the promotion is done to the medical practitioner who is going to generate this prescription, so that there will be sale of medications and the product will be used by the patients. So it will be done to doctors, mostly doctors. Direct advertisement does not take place except few medication, the over the counter drug. Some advertisement do take place by celebrity endorsement, which are being advertised under the name of public education. So these are basically to inform the patient, so that patient can ask to the doctors for these medications. Some inhalers or some vaccines, so that patient comes to know it and they can pursue the doctor to prescribe that. That's a different strategy of the pharmaceutical company for marketing. So promotional literature is for marketing by the pharmaceutical companies and the distributors. So strategies: how? Visit by medical representatives, drug promotional literature, free samples. Free samples are given. Free samples are given for use by physician and his family. It can be given to the patient also. Supply of educational material, maybe books, maybe journals, scholarly literature, journal, books, article. CME means continuous medical education, what is known as by the name seminars. Seminars and other medical events. These medical events are being sponsored by some pharmaceutical companies where the drug is promoted. Advertisement in medical journal, because it will be read by doctors. It will be read by doctors. Medical journals are for doctors, so it will be popularized within the doctors. Then there are unethical practices. Best not told. Acha. So, drug promotional literature, the essential information that should be there in the drug promotional literature. So, obviously promotion is being done by a company, তাহলে তার একটা ব্র্যান্ড নেম থাকবে, so there will be brand name. So for any brand name there will be a non-proprietary name or a generic name, ঠিক আছে, international non-proprietary name, approved generic name. Then there must be dosage form. By dosage form, what is meant by dosage form? Capsule, syrup, tablet, this is the dosage form. Then concentration or amount per unit. For syrup, amount gram per ml, or for tablet, certain grams, milligram or gram, whatever be the. Excipient. Excipient, what is excipient? Huh? Excipient কি? ওই বল excipient কি? হ্যাঁ, other than the active pharmaceutical ingredient ছাড়া আর যা যা আছে, maybe dissolution agent, fillers, ঠিক আছে, binding agent, flavoring agent, coloring agent, ঠিক আছে. So why should that excipient be mentioned? Because certain excipient produce certain adverse reaction, ঠিক আছে. Approved indication. Indication is approved by CDSCO, ঠিক আছে. A drug is, when it is licensed, it is approved for a particular indication and the drug has to be utilized for that indication only, ঠিক আছে. There may be repurposing, but that needs a separate licensing, ঠিক আছে. So approved indication. Dosing regime, what do you mean by that? The route of administration, number of days, number of times that drug should be administered, ঠিক আছে, timing of dose, relationship with meal. When does relationship with meal becomes important? তো একটু পিছনে কেন, কিছু শোনা যাচ্ছে না. So give an example. Tetracycline inhibited by calcium, ঠিক আছে. Or there are certain drugs that must be having in empty stomach, ঠিক আছে. বুঝতে পারছি না. ঠিক আছে. So like the PPI, proton pump inhibitor, they are taken in empty stomach, ঠিক আছে. Use in special population. Special population means first and foremost pregnancy. Why pregnancy is important? Teratogenicity, ঠিক আছে. Then lactation, then for children, for renal impairment, there may be liver failure. If a drug is nephrotoxic, it is best to be avoided in people with renal failure, ঠিক আছে. Or the drug is being cleared by kidney, then if there is renal failure you need dose modulation, or it may be avoided as a whole, ঠিক আছে. Potential ADR and their frequency, ঠিক আছে. যে ADR, the ADR that can happen along with their frequency. Then interaction with other drug, foods and alcohol, ঠিক আছে. অ্যালকোহলের সাথে ইন্টারাকশন, ডাইসালফিরাম রিঅ্যাকশন, ঠিক আছে, মেট্রোজিল. Then special precaution and contraindication. So suppose if a drug is emetogenic, Warfarin? No. If a drug is emetogenic, to give an antiemetic medication like opioids, ঠিক আছে, chloroquine, highly emetogenic, to give some antiemetic medication to take the precaution, or বলছিল warfarin, ঠিক আছে. So in warfarin, take precaution that there may not be increased chances of bleeding. You need monitoring. How? কি করে মনিটরিং করে? কি করে করে? INR, ঠিক আছে, INR মনিটরিং করতে হয়, ঠিক আছে. Various drug has various strategies, ঠিক আছে. Then legal category. So what is category H? Schedule H, প্রেসক্রিপশন ছাড়া বিক্রি করা যাবে না, ঠিক আছে. So there is prescription drug and then there is over the counter drug. Then there is cost. Why is cost important? You are going to prescribe the medicine to a patient. The prescription must be as per their socio-economic conditions. If a drug is too costly, you can't give it to a person from lower socio-economic condition, may not be able to afford it. Then reference to scientific literature, studies, data, graphical presentation showing efficacy of drug, ঠিক আছে. Last, name, address, licensee of the manufacturer or distributor. Acha. So the question comes, what are the information related to a drug you would look in a drug promotional literature? ঠিক আছে, পয়েন্টস গুলো যেন থাকে. It comes as a table in practical দেওয়া হয়, ঠিক আছে. আর ছবি তুলে হয়ে যাওয়ার পর এখন ছবি তুলি, আমি তো প্রথমেই বললাম. What are the information related to a drug you would look in a drug promotional literature? ঠিক আছে, this ছিল, তার ওখানে বোধহয় ছিল. These 13 points, write these 13 points. These are going to fetch you good marks. So there are guidelines to ethical promotion. Promotion is needed, otherwise you are not going to know what are the drugs available, ঠিক আছে. There is nothing wrong in promotion. So no financial or material incentives, ঠিক আছে. Promotional of legally licensed drugs, ঠিক আছে. Not anything and everything can be promoted. Suppose a drug is being licensed in America, cannot be sold in India unless and until it is being passed by CDSCO, ঠিক আছে. আচ্ছা, legally licensed drug, all claims should be scientifically proven, up to date data supported by scientific evidence. There may be many vague claims that should not be entertained. Should not conceal information. So suppose a drug has some adverse effect. Suppose there is 1% chance of anaphylactic shock, and that is being withheld, that is not being said. So it will lead to sudden presence of anaphylactic shock, ঠিক আছে. So there should not be concealed information. information must be made available. Wording and illustration as per scientific information. There are various wording that comes, and 90% doctors are using it. Number one brand. So these are vague terms. Nobody is checking how many doctors are using it or what is the number one brand. Yes, scientific claim should be available to health worker and to the public. So if there is some scientific claim, today there is Google. If you search in Google, it should be available to you. Not that some distinct journal in some distinct country has published it and nobody knows anything about it. Yes, it must be available to the medical community as well as to the public. MR should be adequately trained and have adequate knowledge. They are going to present the medicine to you. If they are not knowledgeable, they will fumble. Now, text, what should be there in the text? Identity of the product, safety and efficacy, cost benefit analysis, appropriate study design to measure outcome. ठीक है? Statistical analysis. Now here all the problem lies. So it is said that there are 3 types of lies. Lies माने मिथ्या कथा. Lie, damn lie, then come statistics. So by statistical analysis, you can turn anything into anything. So statistical category. ठीक है? So how can you check it out? If you get the raw data and you can yourself make an analysis, you can check it out, but nobody has so much of time or energy. ठीक है? Proper scientific data, proper scientific analysis and the raw data. If raw data is being supplied to you and you can check it out, that is the best solution, but nobody has such time, nobody has such energy to do it. Graphs in promotional literature. ठीक है? Proper scientific graph. So bar diagram, seen bar diagram? Bar diagram. ठीक है? Suppose the difference of two medicine is very small, but graphically it is being presented as such that there is a huge massive difference between two medicine. ठीक है? Graph that can be easily deciphered. খুব কমপ্লিকেটেড কিছু একটা গ্রাফ দিয়ে রিপ্রেজেন্ট করা হলো, nobody can decipher, it is of no use. Erroneous diagram, just now I told. Improper labeling, without any label, no nothing, some diagram is being there. Improper unit. Referencing, this is very important, not for examination. ठीक है? Now proper referencing. Referencing means the claim that is being presented to you is being published by certain journals. Best of them are peer reviewed journals. What do you mean by peer reviewed journal? Any idea? No. So if a article is being submitted, it is being reviewed by various personality or various luminous personality in that field. ठीक है? Suppose an article of diabetes is being presented. So the article is being sent to number of diabetologists or endocrinologists who go through the article, give their opinion, and then it is published. So that is a peer-reviewed journal. A large society, large people who are involved in that field, they give their inputs. So that is peer-reviewed journal. Easy accessible and reference. So that must be easily accessible to you. Index journal, peer-reviewed journal. Conflict of interest, sponsorship. So what do you mean by conflict of interest? Now sometimes it happens that when a company promotes a drug, it funds certain study to make sure that the outcome that comes is in favor of the drug. That is known as conflict of interest. The company is interested in the drug promotion, so they are funding studies to make the drug look marvelous. Illustration. So image, symbols, iconography, they remains. So that must be scientific. Some out of context illustration may be there to stimulate prescription, that is unethical. Stereotyping. There are certain stereotypes in the society that must be avoided. Unethical imaging, which is not acceptable to the society. MR, proper knowledge, proper delivery of the message, and aggressive campaigning. Campaigning within the ethical guidelines is okay. There may be free samples given, there may be certain books given, there may be articles given, there may be low value products like pen or pad given, but certain things like financial incentive or some high end good, that is considered to be unethical. To avoid flattery, inducement and unverifiable claims. Flattery মানে? ধোকা আপনি কি ভালো, আপনি কত, that is a flattery. What he has told is perfectly right. Inducement means certain financial or incentive. Unverifiable claim. Now let's see certain. এটা দেখা যাক, this is a drug promotional literature. So Paxidep CR, কি আছে, paroxetine enterocoated control release tablet. তাহলে নাম দিয়েছে, জেনেরিক নেম দিয়েছে, এক্সিপিয়েন্ট বা অন্য কি আছে সেটাও দিয়েছে, enterocoated tablet. Each tablet containing 12.5 or 25 or 37.5 mg dosage দিয়েছে, but it does not mention the timing or regime. So now here you can see it is being, an old lady is being represented as a person suffering from depression, and this is a typical stereotyping. Only old ladies are not suffering from depression, other population do suffer from depression. So he said, I just need a little time. So there is what she is undergoing, that is being said. It's a nice presentation. Now here you can see that by having this medication she has completely recovered. Something that is unclaimed. Not every person will be responding to this medication. So there are no adverse effects mentioned in this journals. This psychiatric medication has numerous adverse effects. So there you can see some graph has been given, placebo and paroxetine. Some scales have been given, proper scales. So bar diagram showing how this medication works, how well this medication is working. Quality of life, how the quality of life being improved by this medicine. So what does not, what it fails to mention? Adverse effect. It does not mention the courses, does not mention the cost. So the company is being given, address is being given, but does not mention the licensing number. And scientific study is being given, scientific references are being given. So more or less okay. That we can. Now we come to package insert. Package insert are typically present within the packets. These are package insert. Leaflet along with each packet. Summary of section of the full prescribing information that are considered essential to the consumer to know. Certain information that the company thinks that the consumer should know is present in this package insert. In India, package insert should be present for 4 years from licensing. After that, they can be there or they cannot be. The next thing that is important is language. So, number of package insert you will see are there in various languages, in Bengali, in Odia, in Hindi, other than that of English. So, if you are aiming to reach the patient, so it is best written in a language that is understandable to the patient. Some scientific, all the patient are not able to go through all the scientific terms. They don't have such knowledge. That should be informative to the patient. So package insert is a package insert of montage. ঠিক আছে, তো কি আছে? Ceftriaxone and tazobactam for injection. দেখতে পাচ্ছেন না, ঠিক আছে, ডোজিং দেওয়া আছে, স্ট্রাকচার দেওয়া আছে, মেকানিজম অফ অ্যাকশন দেওয়া আছে। ঠিক আছে, তারপরে organism that are going to be cured, that is also being mentioned. Then plasma concentration required, the pharmacokinetic parameter, that is also being there. ঠিক আছে, ডোজেজ না ব্লাড টেস্ট না স্কিন টেস্ট করতে হবে। ঠিক আছে, ডোজেজ, ডাইলিউশন, দেন স্টোরেজ, everything is been there. So at the top you can find for the use of registered practitioner and laboratory or a hospital only. ঠিক আছে? A patient cannot decipher such huge amount of information. বুঝলি? কোথায় তোরটা গেল কোথায়? সবাই দেখেছে? দেখে নে। ওটাই আসে, একটাই লিখতে হয়। বললাম তো তোকে, না কি আসে সেটা বললাম। So gout is something we left out the other class. ঠিক আছে? So what is gout? Metabolic disorder of urine characterized by hyperuricemia. মানে hyperuricemia মানে what do you mean by uric acid joint ঠিক আছে? So there will be increased amount of uric acid in the blood. ঠিক আছে? So what happens? Hyperuricemia, this uric acid is sparsely soluble in water. When it is sparsely soluble in water, it is going to form crystals. Where does it crystal form? In the joints, in the synovial fluids. The crystal is formed. Then, because there is this uric acid crystals, it will invite macrophage. Macrophage is going to phagocyte these crystals. Once the crystals get phagocyzed by macrophage, they are going to release inflammatory mediators. ঠিক আছে? That is going to attract neutrophil. ঠিক আছে? So there will be even more inflammation and there will be pain, stiffness of joint. ঠিক আছে? আগের দিন গাউটের বোধহয় এটা হয়েছিল, তাই না? পিডাকটা করতে বলেছিল। হ্যাঁ, ঠিক আছে? This is in short. So what happens? These crystals are being phagocytes by the macrophages and they secrete interleukin 1, the chief mediator. ঠিক আছে? So how is this phagocytosis taking place? There is certain things known as tubulin. Have you heard it? Tubulin wall. কি প্রোটিন তো আমিও জানি। তারপর what is it? What is its function? হ্যাঁ, তো ওসব বললে ফোন করে বললে হবে না, ঠিক করে বলতে হবে। টিউবুলিন, হ্যাঁ, শেপ, ঠিক আছে, মোবিলিজেশন বলছিস, ঠিক আছে, ঠিক আছে। স্ট্রাকচারাল প্রোটিন, it forms the endoskeleton of cells, ঠিক আছে। It helps in secretion of substances as well as phagocytosis as well as mobility of the cells, the neutrophil that migrates, that is helped by the tubulin. The tubulin পড়িসনি? হ্যাঁ, এতে বায়োকেমিস্ট্রিতে ঠিক আছে। That is in short the pathology of gout. Now gout, there will be acute attack or there will be chronic gout. Acute attack characterized by ঠিক আছে, pain, redness, swelling in the great toe of foot. That is the characteristic of acute gout. Acute gout হলে কি করতে হবে? মেডিকেশনটাও বলছিস। What will be the target? to reduce inflammation and pain of the joint, ঠিক আছে, and to give relief to the patient. That is the objective of acute gout. And for chronic gout, you have to reduce the uric acid level in the blood. That is the target of treatment of chronic gout. ঠিক আছে, in acute gout, reduction in uric acid level has no role. ঠিক আছে, for chronic gout you need to reduce the uric acid level. গরুই বুঝতে পারছিস কি করছিস ল্যাপটপে? আমি ভগবান। So uric acid, how it is formed? Uric acid is formed by purine metabolism. Purine is present in DNA, RNA. ঠিক আছে, purine is synthesized from pathway. কি pathway আছে? de novo synthesis and salvage pathway. ঠিক আছে, so it has low water solubility. ঠিক আছে, so solubility decreases at lower pH. তাহলে what is the important? In a joint, inflamed joint, the pH becomes acidic, so there is further deposition of crystals. ঠিক আছে, then precipitates and deposited in joint, kidney, subcutaneous tissue. Subcutaneous tissue deposition কি বলে? টফাই। ঠিক আছে, so first we come to acute gout. Acute gout এর treatment NSAIDs. ঠিক আছে, then corticosteroids, then colchicine. So NSAID had been taught to you, তাই তো? পড়েছিস তো? NSAIDs এর কিছু অ্যাডভার্স এফেক্ট বল, এই ঘড়ুই বল। পেপটিক আলসার, তারপর বল, মুন্ডুল বল। নেফ্রোটক্সিসিটি, ঠিক আছে। কর্টিকোস্টেরয়েডস এর কিছু অ্যাডভার্স এফেক্ট বল। ইমিউনোসাপ্রেশন, আর এইচপি অ্যাক্সেস, আর ইয়ার লস, ঠিক আছে, আর অস্টিওপোরোসিস, ঠিক আছে, তারপরে গ্যাস্ট্রিক আলসার। এক গাদা তো আছে কর্টিকোস্টেরয়েডের, কিছুই বলতে পারছে না কেউ এটা কি, পরীক্ষার কদিন বাকি আছে, তার আগে কেউ কিছুই বলতে পারছে না ঘড়ি এর মধ্যে ল্যাপটপের মধ্যে কি করে যাচ্ছে। ঠিক আছে, so chronic gout treatment is uricosuric drug. Uricosuric drug means that helps in elimination of uric acid. ঠিক আছে, uric acid is being excreted by kidney, so whatever drug helps in excretion of uric acid, that is a uricosuric drug. Synthesis inhibitor, allopurinol, ঠিক আছে, febuxostat. Uric acid metabolism, destruction of uric acid. pegloticase, ঠিক আছে। Come to NSAIDs. NSAIDs are, there may be non-selective COX inhibitor, there may be selective COX2 inhibitor, there may be preferentially selective COX2 inhibitor. ঠিক আছে, নাম বল, এই তিনটে যেটা বললি সেটার নাম বল, এক্সাম্পল দে। কিছু পড়ছে না, ভুলে গেছিস, ঠিক আছে। So what is it used for? Terminates attack, subsides pain, mostly well tolerated, ঠিক আছে। So naproxen piroxicam prevent chemotactic migration, ঠিক আছে। So the treatment by NSAID is symptomatic, you are not addressing the underlying cause, only terminating the attack. Corticosteroid may be administered systematic or systematic. How administered? Pfizer. So if systematic means it is administered either IV or oral, ঠিক আছে, and intra-articular injection, মানে হাড়ের মধ্যে ইনজেকশন দেওয়া হয়, ইনজেকশন ইজ গিভেন right within the joints, ঠিক আছে। it can be given, it can be administered for local action as well as for systemic action. Systemic action হলে কি হয় ও বলেছে একবার, HPA অ্যাক্সেসটা ডিস্টার্ব হয়ে যায়, ঠিক আছে। কর্টিকোস্টেরয়েড এত খারাপভাবে পড়া হচ্ছে কেন? ইম্পর্টেন্ট চ্যাপ্টার, হ্যাঁ আচ্ছা। Then we come to colchicine. So colchicine is a substance that that binds to the tubulin protein. So tubulin protein is responsible for chemotactic migration, for release of inflammatory product, ঠিক আছে, for phagocytosis, ঠিক আছে, and what else it is used in? It is also used in cell division. Suna hai? Yes sir. So what potential other use can be there? Yes. So in cancer cell there is rapid proliferation of cell, rapid division of cell. So if colchicine can be used to prevent that division, it can potentially cure cancer. No such cure is available as of now, but it has the potential to disrupt proliferating cancer cell, a topic of research, ঠিক আছে। So it has neither analgesic nor anti-inflammatory property like that of NSAIDs, ঠিক আছে, binds to tubulin protein, prevent release of inflammatory agents, prevent granulocytic migration. It has rapid response to acute gout, one of the plus points for using colchicine, but it has lot of adverse effects, especially nausea, vomiting, bloody diarrhea, abdominal cramps. Wages. So colchicine prevents the tubulin protein. That is how it function as a drug for acute gout. Now probenecid. Probenecid is a uricosuric drug. So that which helps in elimination of uric acid from the body. So how it does it? Block transporters in renal tubule. So uric acid is filtered in the by the kidney. In the tubules, this uric acid is again reabsorbed. That is being prevented by probenecid. Probenecid is a is a substrate for these transporters. It competes with the uric acid. So, what other substances are prevented from excretion or secretion? শুনেছিস না ঠিক আছে it also prevents excretion of penicillin. So, how this information can be used? Toxicity, yes, প্রথমেই toxicity. So, it increases the half life of penicillin. ঠিক আছে so probenecid can be used in combination with penicillin. ঠিক আছে concentration remains more, half life remains more. ঠিক আছে so probenecid and penicillin can be combined together. So, this is renal epithelial cell, this is the basement membrane, this is the tubular lumen. So, probenecid prevents this transporter. So, penicillin that is being transported across the tubule, that is being prevented, and uric acid which is being reabsorbed by the tubule, that is being prevented. ঠিক আছে for penicillin it reduces secretion, for uric acid it reduces reabsorption. বুঝলি ঠিক আছে so sulfenpyrazole it's the same thing, its mechanism is same as that of penicillin, causes GI ulcer. And sulfur drug, what can happen with sulfur drug? Hypersensitivity. ঠিক আছে all sulfur drug has potential to cause hypersensitivity. Same thing. ঠিক আছে the point to be noted is it is suitable for patient with lower GFR. ঠিক আছে কি তুই লিখছিস না হ্যাঁ suitable can use করে ঠিক আছে it can work in low GFR. So, allopurinol in chronic gout comes as a short note. ঠিক আছে so allopurinol is a suicidal inhibitor. What do you mean by suicidal inhibitor? ঠিক আছে what Anushriti is telling is right. Allopurinol is being first converted into alloxanthine. Now, this alloxanthine binds with xanthine oxidase that prevents the synthesis of this uric acid. ঠিক আছে so it reduces the amount of uric acid. These are medicine for chronic gout. বুঝলি prolonged time of action irrespective of half life, time of action is prolonged. High renal clearance of xanthine and hypoxanthine. So, allopurinol hypoxanthine is acted upon by xanthine oxidase to produce xanthine, and from xanthine oxidase is again acted by again xanthine is acted by xanthine oxidase to produce uric acid. ঠিক আছে now this hypoxanthine and xanthine has high renal clearance. বুঝলি so feedback inhibition of de novo synthesis মানে the newer purine synthesis, that is the de novo synthesis, and another is the salvage pathway. ঠিক আছে so it prevents the synthesis of new purine molecule, so hyperuricemia is reduced. So drug interactions with 6-mercaptopurine, azathioprine, warfarin. Acha, it is used in chronic gout. What is secondary hyperuricemia? Now during cancer chemotherapy, there is increase in this uric acid level in the blood. During cancer chemotherapy, the cells are being destroyed, so they release a lot of this purine. These are being metabolized, that leads to hyperuricemia, that is known as secondary hyperuricemia. ঠিক আছে? আসি বুঝলি? বাহ। So this allopurinol is also used in secondary hyperuricemia and also in Kala-Azar. So you notice one thing, this allopurinol is very closely related to the structure of hypoxanthine. ঠিক আছে? The same thing. Now febuxostat. So febuxostat is not related to the structure of purine. Structure is something different. So no purine xanthine oxidase, non-purine xanthine oxidase inhibitor of it. ঠিক আছে? Structure is not that of purine, does not have this purine ring. This is the structure. ঠিক আছে? So this will be non-purine xanthine oxidase inhibitor. Highly effective in lowering uric acid, rapidly absorbed in GIT. So what is the advantage? Orally highly effective orally. ঠিক আছে? Liver function needs to be monitored. তাহলে in case of patient with compromised liver function, it must be given with care. ঠিক আছে? Not useful in secondary hyperuricemia. এই আসিফ বল, secondary hyperuricemia কি? Pegloticase. Now pegloticase is a recombinant urease enzyme. ঠিক আছে? Urease enzyme is not found in humans. It's a recombinant urease enzyme. So what does it do? It metabolize this catalyze oxidation of uric acid to allantoin. Now what is the property of allantoin? Allantoin is highly soluble in water. So it get easily excreted by the kidney. So because it's a recombinant urease, so what can be the adverse effect? কি adverse effect হতে পারে? There may be hypersensitivity reaction. ঠিক আছে? Otherwise it is used for refractory symptomatic gout. Refractory means
responsive.
Refractory means no medicine is useful in this gout. ঠিক আছে? It is no medication, no other medication are useful in gout. The last resort that is being used. How it is infused? IV every 2 weeks. It's a long time. So purine metabolism, xanthine oxidase inhibitor or allopurinol, febuxostat. So uric acid, probenecid is aiding in excretion of uric acid via the kidney, the renal tubule. Then there is pegloticase that is metabolizing uric acid to soluble allantoin. ঠিক আছে?